Yes, Monday. Not so bad today. Monday. Yeah, went to park. Went over park. I went on park. I went on to park this morning. I thought I'd meet some of my Salford Red Devils friends. Cheery and full of piss and vinegar after the Red Devils defeated Warrington on Saturday evening. But no, I had the park to myself this morning, so I did. Wet and cold and dark. That's the thing. Good weekend myself until the football. We won't mention that. My great friend Michael Cohen turned up yesterday out of the blue. A marvellous surprise. Hadn't seen my old comrade in months. Isn't that lovely? When an old mate pops up and knocks on your door and you're delighted to see him. Because increasingly, as we have become more and more disconnected, I think we are less likely, as a species in 2020, we are less likely to throw the door open and welcome in somebody who's knocked unexpectedly. These days we've been conditioned, I think, to be aghast at somebody turning up unannounced. I was reflecting on that, so I was. I was delighted to see my old pal, Michael. We had a good afternoon, apart from the football. That is, I'm not going to mention it again. Scousers fairly quiet though. They were very loud as United were getting hammered by Tottenham. And then they went very quiet. I don't know what happened afterwards to make them go so quiet. We won't mention it. My country, God's country, your country, Ireland. Well, the National Public Health Emergency Team, or NFET, dipsticks, recommended yesterday that the entire Ireland, or the Republic of Ireland, be moved to the highest level of restrictions in the government's COVID roadmap. They're concerned that the disease is spreading around the country, the highways and byways of Erin. And there are rising numbers in hospitals apparently. So, Stephen Donnelly, right, received a letter from NFET. Now, he's Ireland's health minister. And the Irish Times saw the letter. And this health body, the National Public Health Emergency Team, said, you better put the country back in level 5 in a national lockdown to begin tonight, Monday, at midnight. Now, level 5 means all but essential retail outlets would close, right? So you just have supermarkets, no clothes stores, no record shops, no whatever, just supermarkets. Social gatherings would be restricted and people would only be allowed to exercise within 5 kilometres of their homes. However, bit of confusion. The Irish government is meeting. It's a coalition government, of course. It will meet around about 5:30 this evening to decide whether or not to take the recommendation and to put the country into lockdown for a month. But according to RTE.ie, it looks like the government might reject the advice. We'll wait and see. Regardless, the Irish economic outlook is pretty miserable anyway. Now, Jimmy Cranky is warning of more restrictions. She spoke again at lunchtime, did Scotland's First Minister. She's loving it. The daily briefings, the limelight. Jimmy absolutely loves it. Here she is on television this lunchtime. Jimmy Cranky.
This is further evidence that in Scotland, as it is in many countries right across the UK, the Republic of Ireland and across Europe, COVID is on the rise again as countries have come out of lockdown and, importantly, as we enter the winter period. And of course, we're seeing the consequences of that, not just in the daily case numbers, but also, and perhaps more importantly, in the rise of hospital admissions, in the numbers of people in intensive care, and sadly, in the number of people who are dying from the virus.
Now, the media doesn't do anything to verify any of this. So when you get Jimmy Cranky, or Boris Johnson, or Matt Hancock, or Rishi Sunak, or whoever it is, nobody challenges the figures. So when a government source says, we're seeing the levels of hospital admissions on the rise, we're seeing hospitals get a little bit fuller than they were, and we are seeing an increase in the death numbers. Nobody is asking for any proof. Oh, God be with the days. Doesn't matter anymore. If they say it, it must be true. So Jimmy waxes on about how things are getting bad, not just in Scotland, but in Ireland as well, in England. And, well, there's nobody there to say, come on, you ginger muppet. Come on, where's the evidence, of course? Nobody.
So all of that means that it is vital that we do everything we can to get this situation under control. Of course,
there is no situation.
Of course, in a proportionate way that allows us to take account of all of the different harms, not just that COVID can do, but that our ways of dealing with COVID can also do.
Yeah, the harms that our ways of dealing with COVID can also do. Anyway, on the new restrictions.
There may well be a need for some further restrictions in the near future. I can say that the government will be considering the latest clinical evidence and advice later on today, and the Cabinet will be considering the up-to-date situation when it meets tomorrow morning. If we do decide more restrictions are necessary, and no decision has been taken yet.
Liar, liar, pants on fire. Those decisions have been made, love, and by somebody far, far above, way above your pay grade. Oh, yeah. Much further along the trough, you know.
I want to give an assurance that we will endeavour to give you, the public, and of course the Scottish Parliament, as much notice as possible, as well as a clear explanation of our reasons and rationale. And I want to promise you that we do not impose restrictions lightly. If we decide that extra...
We don't impose restrictions lightly. Again, the notion, you must accept, from the outset, you must accept that she's making the decisions. She's a messenger. She's a front woman, that's all, no more than that. She's told what to say and she says it. And that's about the size of it, right?
If extra restrictions are necessary, it will be because we deem it necessary and vital to get the virus back under control and avoid unnecessary loss of life. But for now, pending any decisions that may be taken and communicated over the next few days, the best thing all of us can do to try to stop this resurgence and bring transmission back under control
is basically heads and shoulders, knees and toes. Wash your face, wash your hands, wash your arse, wash under your arms, get the cotton buds for your ears, do all of that stuff, clean your surfaces, even though the Sunday Times yesterday obliterated the notion that the virus lingers on surfaces. I mean, Nicola Sturgeon is useless, eh? She's useless, isn't she, Pat?
You have gotten me there. As useless as tits on a board.
As useless as tits on a board. Just a front woman, no more, no less. A traitor to her people, to her fellow Scotsmen and women. A sellout. You know, give me fame, give me money, I'll do anything. It doesn't matter what implications, doesn't matter what it will do to people, I'll say and do anything. The cases going up. Of course, the thing is, we know why the cases are going up. You and I know why anyway, don't we? This PCR test is fundamentally flawed. And of course, they know this. The media knows it. Remember, Sunday View yesterday. Listen to this bombshell dropped on BBC presenter Chris Mason by Dr. Nigat Arif on BBC One yesterday morning. Bombshell. This destroys the official story. And yet, here we are, still on a Monday talking about it.
And the Centre of Disease Control actually a long time ago said that there are times when the test can actually come back positive even when the virus isn't alive anymore. So, for example, that's the difference. So I'll let you know. We've had this in the UK with multiple healthcare professionals. For example, nurses who I've known who've had COVID-19, the test came back positive, and then they want to come back to work, but we decided to test them again just to make sure that they were free of the virus. But then the test came back positive. And one nurse had 6 consecutive tests that came back positive.
And this 6 consecutive tests that came back positive. Keep this now in your mind.
And this is the real problem, isn't it? This is the crux of it. Because if you're testing positive, but you're no longer contagious, whether it be the...
Not even no longer contagious. If you are testing positive and it has been a couple of months or 3 months since you had the infection, this is the problem. And if you take for a fact, because the government says it, which means it's a lie. But let's take the government at its word for once. The government says, Chris Whitty says, and Patrick Vallance says, these are the government's chief medical officer and chief scientific officer, respectively. They continue to tell us that they believe that millions and millions of Brits have already had COVID. Most of them will not even be aware that they had it. Here's the problem. If those people are being tested now, what the doctor you just heard from there said, Nigat Arif, it's likely that if they're getting tested now, and we know they're getting tested now, because 50 or 60,000 people a day are being tested, right? More even, 100,000 a day. If they're being tested now, it's coming back positive. But they had the infection months ago, maybe. You see the problem? It's a nonsense, isn't it? I mean, it's beyond nonsense.
Nurse you refer to, or Lily Rose, or the lads that we were hearing from, you're still holed up, but you have no risk to anyone.
Yeah.
Yeah. So you might have had the infection weeks and weeks and weeks ago, but if you get a test now, it'll show positive. If you get a test in 3 weeks' time, it'll show positive. And that explains the escalation of the alleged case numbers. So when you have Sky News presenters this afternoon saying, oh, we've got the latest figures, we've just had the latest figures from the government, 12,000 people have tested positive. There's no guarantee that any of those people are transmitting the virus at all. And don't forget, do you remember 3 weeks ago, Julia Hartley-Brewer, who presents breakfast radio for Talk Radio here in the UK, she had Transport Secretary Grant Shapps on the programme. Remember, Julia wanted to get into the false positive rate. Again, this was bombshell stuff for most people at the time. Sadly, it didn't go anywhere. Listen to Brewer and Shapps.
Has there been any conversation in Cabinet that you are aware of or you've been part of about the false positive rate? And the eminent statisticians and eminent epidemiologists are pointing out that the test we are using in the community, not the Pillar 1 testing in hospitals, testing in the community, may well have a false positive rate of well, we're told it's below 1% by Matt Hancock last week, which means that 9 out of 10 of the positive cases of COVID we are finding in the community when we do random testing, when anyone just puts themselves forward, will be wrong. They will not be people who've got coronavirus. So we have got testing going up 3,899 cases, huge number of cases, but actually 9 out of 10 of those may well be false positives. Has there been any discussion about this serious concern in Cabinet?
Those figures given by Brewer back in mid-September are absolutely spot on and have been verified by, as she said, eminent statisticians and other epidemiologists. The test is worthless. It's ancient. Designed years ago, before this alleged COVID-19 ever existed. It is rubbish. And what she said to him there was a stone cold fact. The majority of people throwing up positive tests are very unlikely to have coronavirus at all. Of course, Shapps hasn't a Scooby-Doo what she's talking about.
Cabinet.
Well, of course, the way that testing's done is actually by the Office of National Statistics. People don't put themselves forward. The Office of National Statistics contact people randomly.
No, that's not what I'm talking about. No, I'm not talking about the data. There's a survey dating. I'm talking about people being told, go and get a test if you've, as Matt Hancock said in July, if you're in any doubt. People who, in local areas where there's been a high rate, councils leafleting saying, go and get a test. People being worried because their kids have been in a classroom with someone who's gone home with a cough. Those people, that testing, 9 out of 10 of those tests that are positive are very, very likely to be false positives. Has there been any discussion of this in Cabinet? And if not, why not?
Yeah, I don't think we're. I don't think that's correct. I don't think we're basing our entire policy on false data, as you've suggested there. I'm slightly confused by your figures, but I'm going to go away and check them because you also said that Matt Hancock said it's probably 1%.
But I'm so sorry. This is my policy. This is a policy that's being made by people who don't understand the statistics and the science.
Well,
I'll do. I've got your phone number. I will send you the document to explain to you what this false positive paradox is.
Haven't you? You've said to me that Matt Hancock said it's 1 in 100. You've told me it's 9 out of 10.
He just doesn't understand the basic mathematics.
9 out of 10.
Now, this is 3 weeks ago, 3.5 weeks ago.
The entire problem, Mr. Shapps. This is the problem. People don't understand what this means. If the false positive rate is below 1%, that means that when you have a very low prevalence in the country and lots of people who aren't having symptoms are getting tested, this is really basic statistical stuff. It means that the false positive rate is 9 out of 10.
9 out of 10. Now, at the end, the conclusion of that, Shapps, who is a front bench Secretary of State for Transport, assured Julia Hartley-Brewer that he would raise this problem at Cabinet level. Now, I've tried to get in touch with Julia Hartley-Brewer to determine, has anybody at Talk Radio heard back from the government? Or have they just gone, have they gone to ground on that? Are they keeping stum, as it were, on that? Massive. And I said this yesterday on Sunday View. The media between them, between the Telegraph, between the Times, between the Daily Mail, between Talk Radio, between LBC Radio, they have the real story. That this is a hoax. Not the virus. I don't know. The virus might be real. There might be a genuine virus. I don't know. But the response to it, claiming that there's a pandemic, claiming that it is deadly, is a hoax. It isn't deadly. Most people have already had this thing. Herd immunity has already been acquired in the UK. But the test is so fucked up, it's so unreliable, that if you had COVID 6 or 10 weeks ago or 12 weeks ago, maybe you felt it, maybe you didn't, you were sick for a few days, you got over it, and your life moved on, it's gone. You're not transmitting it to anybody. It's gone out of your system. You've got the antibodies. But when you get that bastarding test, it'll show positive. The government adds another number and says, look, the cases are going up, look. And now you know that they know it's a farce because they are being held hostage. Whether it's Rishi Sunak, whether it's Jacob Rees-Mogg, whether it's Boris Johnson, they are puppets under instruction. Everything they say and do is preordained by another power, another authority. They are only front men and women. They know it's a hoax, but they can't do anything about it. Why? Take your pick of your reasons. Take your pick. And as for the testing, again, we're staying with testing now in this segment of the programme. Listen to Peter Hitchens on Talk Radio this morning talking about testing with Mike Graham. Peter Hitchens.
Testing has always been a bizarre fetish. And the idea that you could ever conceivably develop a bureaucracy and a surveillance system efficient enough to track down every contact and to isolate every person who was producing the infection was absurd in the first place. The second idea that COVID itself was a disease so dangerous that this would be justified has, I think, now been shown comprehensively to be untrue. And COVID is very dangerous to some people, but not very dangerous to most. And the other thing is, how can, a population of roughly 70 million, what conceivable system could ever discover how many people in this country have a disease which in many cases has no symptoms? You can't do it. It's what all these test and trace figures are figures of how many people have been tested and traced. They tell you absolutely nothing else of any importance. A much more significant figure of that of hospital admissions, which I'm tracking every day. They are rising. There's no question of that. This is time of year when people do tend to get ill with respiratory illnesses.
Now, he says they are rising hospital admissions. There is no doubt about that, he says. But I would ask him if I was Mike Graham, who's his mate. I would say, how do you know, Peter? Where's that data coming from? Are you dealing directly with the hospitals and the people responsible for admitting people to hospital? Are you getting it from them directly? Because I would be very sceptical about hospital admissions going up dramatically right now. Late September, early October. But anyway.
But two claims have been made. One by a BBC journalist who said that the hospital admissions were doubling roughly every fortnight. And the other by the Health Secretary, Matt Hancock, who said on the 18th of September that they were doubling every 7 to 8 days. If you go to the Peter Hitchens blog, you'll see my own tracking of this shows that whatever is happening to hospital admissions, those claims are not borne out by the facts. And this is very similar, of course, to the Witty Valance ludicrous claims which we discussed after they'd made them a couple of weeks ago. Nonsensical. They're simply not borne out by anything that's happening. And the whole attempt, which I think was probably designed to get the Coronavirus Act renewed in Parliament on September the 30th, the whole attempt to get us to believe that a huge and devastating second wave is on the way, is faltering because the facts simply don't back it up.
No, they don't. The Guardian newspaper. God be with the days when I thought I was a lefty. I'm nothing now other than just a bloke like yourself, like anybody else trying to navigate this lunacy. We don't pigeonhole ourselves or box ourselves into an identity anymore. I suppose I'll always think of myself as a Bolivarian, as a student of Salvador Allende and people like that, and Che Guevara and others. But anyway, look, I digress. I used to read The Guardian back in my uni days. The northern editor of The Guardian these days is a woman called Helen Pidd, P-I-D-D, Papa Indigo Delta Delta. Helen Pidd, she's in Stockport. She was asked by BBC presenter Joe Coburn today, what evidence is there, asks Joe, about local lockdowns working? What evidence is there that local lockdowns are working and keeping the case numbers down?
Almost none, actually.
Almost none, actually.
And my colleague Josh Holliday did some excellent data analysis last week, which showed that in almost all of the areas which have been subject to local lockdowns, cases have doubled, tripled, quadrupled. Stockport, where I live, so I've not been able to mix with other households indoors for over 2 months now, apart from a few brief weird weeks in the middle when they lifted it. And here cases, there are 10 times as many cases now as there were on the 31st of July when the restrictions came in. And I think so far of the local areas,
10 times as many cases now as there were on July 1st when the restrictions came in. It's the same in Oldham, you see.
Local areas that have been put under a local lockdown. I think only Luton in the south of England has actually been released from the measures. So they clearly don't work.
They clearly don't work. The PCR test is worthless. Lockdowns don't work. The virus is not dangerous. To 99.99% of people on planet Earth, the virus is going to be as problematic as a flu. They know this. So why carry on with the bullshit? Why? The answer is here, given to the Financial Times by Billy Poison Jab Gates 4 months ago. 4 months ago. Poison jabs, here he is.
But you don't have a choice. People act like you have a choice. People don't feel like going to the stadium when they might get infected. You know, it's not the government who's saying, okay, just ignore this disease. And, you know, people are deeply affected by seeing these deaths, by knowing they could be part of the transmission chain. And, you know, old people, their parents, their grandparents could be affected by this. And so you don't get to say, ignore what's going on here. There will.
You don't get to ignore it. You don't get to say, I don't buy it. I'm not going to have a test. I'm not going to be traced. I'm not going to have a digital passport, and I'm not going to have a vaccine. You just don't get to say that.
There will be the ability, particularly in rich countries, to open up if things are done well over the next few months. But for the world at large.
For the world at large, Billy.
Normalcy only returns.
Normalcy only returns now.
When we've largely vaccinated the entire global population. And
yeah, that's it. That's it, you see. And that's why I said earlier on that Johnson and Sunak and everybody else, Keir Starmer, all of them are compromised. Financially, sexually, some way legally compromised. They are prisoners, hostages to people like Billy Gates and his pals. They know it's bullshit, and yet they push this narrative. They push it harder and harder and harder. Life will be unbearable so that people will take the bloody vaccine. I see Spiro, my pal there, at O_RIPS, Spiro from activistpost.com, Spiro Skoras on YouTube, is making reference on Twitter there to the Operation Moonshot plan. I've talked about this extensively. This is Boris Johnson's announcement and Matt Hancock's announcement that in the future, basically people will submit themselves to testing every other day or every day. They want to test millions of people a day by early 2021, and that is something that will not be temporary. They're saying that will be something that we will have to get used to and learn to live with forevermore. Testing, 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 testing. As they tell us about more exotic bugs and diseases and tropical diseases and pandemics, we get used to being tested. We get used to that test result being uploaded to the digital passport, which is on your smartwatch or your smartphone and all the rest of it. And that's how life is going to be unless we put a stop to it. And by we, I don't know who I mean by we. I really don't know. because the vast majority of people that I come into contact with are going along with it, right? They're loving it. This is the Richie Allen Radio Show. Dr. Vernon Coleman live in a couple of minutes' time. After old, Morrissey. All right.